So there are different sorts of eyebrow surgery, and brow pexy is the least invasive eyebrow surgery. So there are big eyebrow surgeries where you're lifting the whole forehead. They call it a brow lift, but for the most part, it is actually a whole forehead lift, so it's a pretty involved surgery. An example of that is an endoscopic brow lift. The brow pexy is a very minimal procedure where incision is made in that folded eyelid, just like an eyelid lift, and the eyelid lift is actually performed, and at the same time, the tail of the eyebrow is tucked into position where it used to be probably a few years ago when the patient was younger. So patients complain usually of a droop at the tail of their eyebrow and tissue hanging over their eyes in the corners. They also complain of puffiness in the corner of their eyes. And a lot of times patients believe that lifting the eyelids will resolve that problem with the tissue under the eyebrow, but it doesn't. So an additional procedure has to be done called the brow pexy simultaneously as the eyelid lift. Brow pexy by far most commonly is performed at the time of the blepharoplasty because I use the same incision as the blepharoplasty. There's two things that are accomplished with brow pexy that are good for the patient. Number one, the appearance of the eyelids and the corner of the eyebrows are better, and there's less puffiness and less hanging tissue. Number two, because the tissue is secured into position where it used to be at a younger age, the results of the blepharoplasty that's done simultaneously last more years and longer. One of the best things about a brow pexy is that it uses the same incision that's made in the fold of the eyelid and hidden there for blepharoplasty. So the same incision accomplishes two different procedures at once. Therefore, the scar is minimal and hidden in the fold of the eyelid.